The Ivan G. Hileman Award is awarded to a current Bell employee with 15 or more years of employment and dedicated service who has in the past year shown particularly noteworthy performance while demonstrating a commitment to being in it for the long haul. The recipient of the Ivan G. Hileman Award in Mental Health Services is Jessica Putnam.
CHIPP Assisted Living, we have 3 residential homes within York. And what we do there is we support individuals that had either been discharged from the state hospital. We just take in folks that need that higher level of care to try and work with them in the community to keep them out of the hospital. So our homes are set up with staff 24/7. So we have staff there that are able to cook meals for the residents. They also assist them with completing their ADLs, their activities of daily living, if they need help with that. We also have caseworkers during the day that are there to kind of help make sure the residents have their medications that they need. They work closely with the intensive case managers to make sure that they're attending appointments, and just support them in their daily activities and working on the goals that they have within the program. I think our caseworkers and our hourly staff really had to step up and maybe do some things that they weren't used to doing to try and work better with the county, because the county closed down, and they're one of our main supports. Some of our psychiatric services were more limited because of that, so I feel like our staff really had to step up some of those supports and maybe kind of step out of their comfort zone to support individuals in ways that we weren't always doing before, and with even some of the Bell programs closing down, a lot of our folks attend those programs. So those folks were now in the home 24/7 when some of them were used to being gone a couple hours a day at either our drop-in center or here at groups. We encourage them to get out into the community and do the things that they want to do, and then now we're saying you can't do that. So I think that was one of the toughest challenges, is supporting them through this. We've done pretty well over the last year despite our shortages. We are finding that it is difficult. A lot of our hourly staff are working a lot of hours. Our staff have been strong and they've been willing to work those hours, understanding that that's been tough, but that's what has mostly brought us through this. Our staff are great. I think to me it's just a constant conversation and checking in with folks. How are you doing today? Is there anything that you need? I really try to put myself out there to my staff, and encourage them, because I think sometimes they feel like, well, I don't want to bother you with that, that you have bigger fish to fry, some of them say. And for me, it's like, well, this program is my fish. This program is part of my responsibility as well as your guys. So I think just being there for them, being dependable, being approachable, and that for me was tough through this, because we all dealt with the pandemic. I think not everybody dealt with it in the same way. But I think just even understanding where people are coming from and them understanding me as well, I think was a huge piece of it. Just trying to put everything in perspective, and just kind of meet them where they were too, because we all dealt with this differently. I think it's important, and I think to one of our actual specific individuals who came from the state hospital, who had been there for over 15 years, I believe it was, that she was there. And I think these guys, they live 24/7 in this house. So they become, we are a support system for them. And for her to let us know how much she values us and to see that and to just see how happy she is living in the home. I mean, to me, that makes it worth it at the end of the day, to see just how happy she is. And it's a much less restrictive setting than what the state hospital was for her.